Hello everyone, thanks so much for joining me today. My name is Lydia and this is Time with Lydia the Pharmacist. A warm welcome to you all. If you're new to this channel, this is a channel where we educate ourselves on common health problems. We provide advice and information on health and well-being. So please don't hesitate to hit on that subscribe button and also on the notification bell so you don't miss out on anything that I upload. To all our returning subscribers, thank you so much for the overwhelming support. I'm really grateful. Thank you. Today, I'm going to be spending some time with you talking about a very interesting topic. This is a topic that most of my loyal subscribers have requested that I talk about, and we are going to be talking about arthritis. Our main highlight is going to be on the treatment of arthritis. So please do stay with me so you can learn something new today. First of all, I'm going to give a brief overview of what arthritis is. We'll look at the symptoms of arthritis, the two main types of arthritis, and how they occur. And then I'm going to be looking at medical treatment, lifestyle changes, as well as surgical treatment of arthritis. And do watch out for my next video because I'm going to be talking about some foods that you can take to help prevent arthritis. So arthritis is the swelling and tenderness of one or more joints. The main symptoms of arthritis are joint pain and stiffness, which typically worsens with age. The most common types of arthritis are osteoarthritis and rheumatoid arthritis. Treatment of arthritis vary depending on the type of arthritis, and the main goal of arthritis treatment are to reduce symptoms and improve quality of life. Symptoms vary depending on the type of arthritis, and the main symptoms of arthritis at the initial stages may include joint pain, knee or hip pain, swelling, redness in the joints, tenderness in the joints, loss of appetite, stiffness, and a decreased range of motion. So now let's look at the causes of arthritis. Arthritis is caused by various reasons, and the common causes include wear and tear of cartilage in the joints. You can also have metabolic abnormalities, and that is when there is imbalance of many chemical substances in the body. An infection, such as a bacterial or viral infection, can also cause arthritis. And also an autoimmune disease, that is the body mistakenly fighting its own cells, can also cause arthritis. Now let's look at the difference between osteoarthritis and rheumatoid arthritis. There is always a confusion as to what is osteoarthritis and what is rheumatoid arthritis. So I'm going to give a clear definition or a clear description of what osteoarthritis is and what rheumatoid arthritis is. These are the two common types of arthritis. So osteoarthritis, this is the most common type of arthritis, and it involves wear and tear, which causes damage to a joint cartilage. The cartilage is the hard, slick coating on the ends of bones where they form a joint. You know, the cartilage cushions the ends of the bones and allows nearly frictionless joint motion. But enough damage can result in bone grinding directly on bone, which causes pain and restricted movement. This wear and tear can occur over many years, or it can be hastened by a joint injury or infection. If cartilage in a joint is severely damaged, the joint lining may become inflamed and swollen. Now, rheumatoid arthritis. In rheumatoid arthritis, the body's immune system attacks the lining of the joint capsule. The lining is a tough membrane that encloses all the joint parts. The lining becomes inflamed and swollen. The disease process can eventually destroy cartilage and bone within the joint. There are some things that can put you at risk of developing arthritis, and these include family history. Some types of arthritis run in families, so you may be more likely to develop arthritis if your parents or siblings have the disorder. Age is also a risk factor, and the risk of developing arthritis increases as you grow. Also, sex is a risk factor. Women are more likely than men to develop rheumatoid arthritis. And also, when you've previously had a joint injury, perhaps whilst playing a sport, then you are more likely to eventually develop arthritis in that joint. Obesity is also a risk factor. Carrying excess pounds puts stress on your joints, particularly your knees, your hips, and spine. People who are obese have a higher risk of developing arthritis. Now, a highlight for today: treatment of arthritis. Arthritis is treated in various ways, and treatment focuses mainly on relieving symptoms and improving joint function. You may need to try several different treatments or combinations of treatments before you determine what works best for you. First of all, let's talk about medications that are used for the treatment of arthritis. The medications used for arthritis vary depending on the type of arthritis, and commonly used arthritis medications include non-steroidal anti-inflammatory drugs, or NSAIDs for short. These can relieve pain and reduce inflammation. Examples include ibuprofen and naproxen. And do check out my video on ibuprofen if you haven't yet seen it. There's so much information about the drug in that video. These drugs can cause stomach irritation, and they may increase your risk of heart attack and stroke. So make sure before you take them, they are prescribed by your doctor, and make sure you take them according to how they have been prescribed. They are available as creams and as gels, which can be rubbed directly on the joint where you're feeling the pain, and they are available as tablets that you can take. There's also another group of drugs called counterirritants, and these are creams and ointments that contain menthol or capsaicin. Capsaicin is the ingredients that makes hot peppers spicy. So when you rub them on your skin, you feel the hotness, and rubbing these preparations on the skin over your aching joint may interfere with the transmission of pain signals from the joint itself. You can also use steroids, and steroids such as prednisone reduce inflammation and pain and slow joint damage. Steroids may be given as a pill or as an injection into the painful joint. Side effects may include thinning of bones, weight gain, and diabetes. Another group of drugs that are prescribed only by specialists are called the disease-modifying anti-rheumatic drugs, or DMARDs for short. These drugs can slow the progression of rheumatoid arthritis and save the joints and other tissues from permanent damage. Now let's talk about lifestyle and home remedies that you can carry out to help control arthritic pain. In many cases, arthritis symptoms can be reduced with the following measures. Weight loss is number one. Excess weight puts extra stress on weight-bearing joints, and losing weight may increase your mobility and limit future joint injury. Exercise, that is regular exercise, can help keep joints flexible. Swimming and water aerobics are recommended for people with arthritis. The reason being that the buoyancy of the water reduces stress on weight-bearing joints. You can also use heat and cold pads to help reduce pain. Heating pads and ice packs may help relieve arthritic pain. There's also assistive devices, that is canes, shoe inserts, walkers, raised toilet seats, and other assistive devices can help protect joints and improve your ability to perform daily tasks. Now, if medicines and lifestyle changes are not helping, then your doctor may suggest a surgery or an operation, such as a joint repair, to help relieve the arthritic pain or to stop the bone from further deterioration. So the first kind of surgery that can be carried out is a joint repair. In some instances, joint surfaces can be smoothed or realigned to reduce pain and improve function. These types of procedures can often be performed through small incisions over the joint. There can also be joint replacement, and this procedure removes the damaged joint and replaces it with an artificial one. Joints most commonly replaced are hips and knees. There's also another type of operation called joint fusion. This procedure is more often used for smaller joints, such as those in the wrist, ankle, and fingers. It removes the ends of the two bones in the joint and then locks those ends together until they heal into one rigid unit. There's also alternative medicines such as acupuncture that can be carried out to help with arthritis. I'm not going to go much into the alternative medicines that you can use or alternative therapy that you can use for the treatment of arthritis. I'm going to prepare a separate video on alternative medicines for arthritis. So do look out for that video. Also, I'll be preparing a video on foods that you can take to help prevent and treat arthritis. So look out for that video as well. I hope you have learned something new today. Please give this video a thumbs up. Share this information with family and friends. And if you haven't yet subscribed to this channel, please hit on that subscribe button and also on the notification bell so you don't miss any video that I upload. Thank you once again for your time today, and I hope to see you soon in my next video. Bye for now.